In this video, we're going to cover 5 must-know airway obstructions for EMTs. The airway is extremely important. It is a part of the respiratory system, and it is required to transport air from the outside environment down into our lungs. We need this air in our lungs because that is how oxygen is moved into the bloodstream and then moved to every single cell in our body. So let's take a look and see what these 5 basic and really common obstructions are for the airway. So number 1, we have the tongue. The tongue is a really common airway obstruction with primarily unconscious people, and it's not actually the tongue that obstructs the airway, but when somebody is unconscious and they lose that muscle tone, the tongue can fall back, right? And the epiglottis can fall back over the trachea. The epiglottis is there to protect the trachea, but in an unconscious person, it can occlude the airway. Number 2, we have fluids, and these fluids can include saliva, blood, mucus, and vomit. We see these in various conditions. Most of the time, somebody with altered mental status or unconscious could have saliva, mucus, or vomit. If they're intoxicated, overdose, saliva, vomit, and mucus can become an airway obstruction. And it's simply because if it's in the mouth, the air cannot pass. Also, you run the risk of it getting into the trachea and into the lungs, and we call that aspiration, and aspiration can cause many complications. Number 3, we have swelling. A lot of times we'll see swelling with allergic reactions or anaphylaxis, but swelling is also possible with burns, and so swelling can be really dangerous. A lot of the causes of swelling will require advanced life support, possibly intubation in order to manage, but we can definitely, as the EMTs or at the BLS level, we can definitely start some treatment process to try to assist the patient and ventilate them, but we'll talk more about that later. Number 4, we have foreign body. So a foreign body can be anything that's not supposed to be in the mouth, right? Food, toys, anything you can think of, right? Often we deal with children with foreign body airway obstructions. They like to put a lot of various things in their mouth that can cause choking, and with foreign bodies we can have partial airway obstructions and we can have total or complete airway obstructions. And it's really important that we always keep some type of foreign body in mind when we're dealing with healthy children who have had an acute onset of respiratory distress. Finally, number 5, we have trauma. So obviously, there are various ways that traumatic injuries can cause an airway obstruction. Again, swelling is one, blood is another, teeth or other broken bones in the airway or in the mouth can definitely be a problem. Blood clots, also penetrating injuries to the neck or face or chest can definitely cause an issue. So trauma, there's definitely many ways that trauma can cause airway obstructions. So if you have a patient with an airway obstruction, the first step is really identifying that there is an airway obstruction. And we know that the most basic assessment mnemonic is ABC, right? Airway, breathing, circulation. And that's typically what we use in medical patients. So when we talk about airway, there are various steps that we need to follow in order to make sure that we're covering all our bases with the airway assessment and to initiate treatment. So here's the 5-step airway management framework that I think through when I'm assessing a patient's airway. So step number 1 is going to be assess, right? Very basically, when we make patient contact from the door, we're looking at their posture and whether they appear to be in some type of distress or not. As we approach them, we're listening for sounds like gurgling and stridor that might indicate that there is some type of airway obstruction. And finally, once we get up close, we can do a more thorough assessment. We can look, we can listen, we can check for chest rise, and we just really want to do an initial thorough assessment of the airway as soon as we make patient contact and even from the door. Step number 2 is if we determine that there is some type of airway obstruction, initially we want to clear that out. If there is blood in the airway, we want to get that out. If there is food or other things in the airway that can be easily removed or suctioned out before we progress, we definitely want to clear anything out of the mouth because we don't want to push that down into the lungs. Step number 3, we want to open the airway and we want to apply any adjuncts if necessary. So to open the airway, we can do a head tilt chin lift, we can do a jaw thrust, we can also use adjuncts as in an oropharyngeal airway or a nasopharyngeal airway. So we want to open that airway and we want to maintain it open with airway adjuncts. Step number 4 is we want to oxygenate and ventilate if necessary. If the patient had or has an airway obstruction, we want to get oxygen on as quickly as possible to try to supplement their oxygenation. And then if we realize that the patient is not moving enough air in and out, if the patient is not ventilating effectively, then we want to assist their ventilations with a BVM. Okay, so that step number 4 is oxygenate and ventilate. And finally, step number 5 is maintain and re-evaluate. So we want to make sure that we are maintaining an open airway, whether it's with a jaw thrust, or if we're using a adjunct like a OPA or an MPA, we want to make sure that they are continuing to maintain an open airway. And if there is blood that is refilling the mouth or draining into the mouth, we want to keep that suctioned. So we want to keep the airway open, we want to keep it clear, and we want to continue to reevaluate the airway to make sure that there is no chance that the patient's airway is going to be obstructed again, or that we are not properly oxygenating or ventilating the patient. The airway is extremely important in every single patient, and it needs to constantly be on our mind whether or not we have an open and patent airway. In the end, we want to make sure that we assess the airway. We keep it clear. We keep it open. We use an adjunct if necessary. We oxygenate. We ventilate. We re-evaluate in order to maintain an open and patent airway. If you have any questions or comments, please leave them down below. I'm going to be posting more videos for EMT and paramedic students, not just to pass the exam, but to also dominate your time when you get out on the job. I want you to be the best EMT or paramedic that you can be and really know this stuff because it's important when you're out there treating patients. Let me know any other videos you'd like to see, and thanks for watching.